Tungasogitsi, welcome everyone to Inuit Tapiriit Kanatami. So thrilled to see everyone here today. Thank you all for joining us. ITK works at the national level to advance Inuit Nunangat priorities. We acknowledge and are grateful for the opportunity to do this work on the unceded territory of the Anishinaabe Algonquin Nation. I'd like to recognize the Honorable Jean-Yves Duclos, Minister of Health, also the Honorable Mona Fortier, President of the Treasury Board. So good to see you here today, just across the street. And also the CIHR President, Dr. Michael Strong. Thank you so much for your partnership and for joining us here today as well. We are excited today to announce a partnership with and an opportunity really with the Canadian Institutes of Health Research to create an Inuit Research Network. It is a grant and will provide funding directly to Inuit representational organizations to participate within the health research field. We have been working with the Canadian Institutes of Health Research for a long time. And most recently, over the last 4 years, we have created an MOU with CIHR. We have created a joint work plan between myself and Dr. Strong. We have done a number of different scopes of work, not only in capacity development of this particular grant opportunity, but also in the area of tuberculosis and tuberculosis elimination as well. We can only be here today because of the support that Inuit Tapiriit Kanatami receives from our land claim regions. Makivik Corporation, Nunatsiavut Government, Nunavut Tungavik Incorporated, and the Inuvialuit Regional Corporation all are instrumental in developing this particular proposal that culminates today in this announcement. I'd also like to just recognize CIHR and the leadership that has been shown to do things in a new way. Traditionally, Inuit land claim organizations or representatives of Inuit are not eligible for funding, whether it be at CIHR or other granting institutions of the federal government. We are working to change that based on our 2018 National Inuit Strategy on Research and the very clear wish for Inuit to self-determine within the research field. We are thankful to have partners that share this vision with us and want to work to meaningfully include Inuit in the research landscape across this country. Inuit are not looking for a completely separate approach to research. We are working with institutions. We are providing an Inuit-specific lens to the work we do, to the governance that we create, research functionality and research partnerships, and also the way that we might imagine research projects unfolding. But ultimately, we are a part of the research landscape in this country and wish to continue our relationships with research institutions and with governments. With that, I would like to invite Minister Duclos to say a few words.
Bonjour tout le monde. Good afternoon, everyone. Unasakut. Merci beaucoup, Président Obed, pour votre mot d'introduction et pour votre accueil dans la grande famille d'ITK. I would like also to begin by acknowledging that we are indeed on the traditional unceded territory of the Anishinaabe Algonquin people. And I also would like to acknowledge the presence of Dr. Michael Strong and Dr. Margot Greenwood, both from CIHR, and our colleague Mona Fortier, who is President of the Treasury Board, as we know, also MP from Ottawa, Vanier, and Dr. Brendan Hanley, one more doctor, who happens to be Member of Parliament from Yukon. So thank you, both of you, for being here today. And support, as President Obed said really well, of Inuit self-determination in health research. And that reminds me of a recent visit with communities in Nunavut just this past June. Despite the physical isolation from others, I saw clearly resilient communities that collaborate and work as a whole. I also heard and felt the pain of families who had to say farewell to loved ones and had to move away in order to receive care. Hearing them, we understood, and I certainly understood, that communities are close-knit and they are dedicated to and committed to take care of one another. Inuit are indeed active members of their communities and are already doing much of the work in caring for their families and neighbors, and therefore much of the work leading to better health and wellness. In that regard, and since 2017, the Government of Canada has been working with President Obed and ITK and other Inuit leaders through the Inuit Crown Partnership Committee to make important steps toward Inuit self-determination. Last April, Prime Minister Trudeau and President Obed also announced an important milestone in our relationship with the endorsement of the Inuit Nunangat policy. At the same time, we were able to announce funding of $25 million to support the implementation of the policy and promote community and individual well-being throughout the Inuit homeland. ITK, as we just heard from President Obed, has also recently released its National Inuit Strategy for Research, and CIHR has supported ITK in developing the groundwork for a research network that responds to the distinct needs and priorities of Inuit communities. ITK and CIHR's close relationship continues to grow. I am therefore pleased to announce in that particular respect that the Government of Canada, through CIHR, is providing $6.4 million to ITK to support the implementation of that Inuit Research Network. This network will advance Inuit self-determination in research by developing Inuit research capacity, infrastructure, governance, policies, and practices. B, strengthen and promote Inuit-led research approaches. C, facilitate partnerships to build awareness and respect for Inuit research priorities. And D, build capacity in Inuit communities by training the next generation of Inuit researchers and knowledge holders. That will help CIHR-funded researchers and research better provide and better use priorities and rely on priorities, design and dissemination supported by Inuit. Overall, by supporting Inuit-led research, the network will improve, as I said earlier, Inuit health and well-being. Maintenant, en français. Le financement de 6,4 millions de dollars offert par l'entremise des Instituts de recherche en santé du Canada permettra de créer un nouveau réseau de recherche Inuit, renforcera les capacités de recherche dirigées par les Inuits et soutiendra les initiatives de recherche qui répondent aux besoins des communautés Inuits. En soutenant la recherche dirigée et priorisée par les Inuits, le réseau améliorera la santé et le bien-être des Inuits. Je tiens donc à féliciter à nouveau le président Obed, le Dr Strong, qui est évidemment le représentant des IRSC, d'avoir franchi une autre étape importante dans ce partenariat essentiel. Merci beaucoup. Thank you, Nakomik. And I would like now to turn to Dr. Strong for a few words.
So, good afternoon to everybody. Bonjour à tous. Una shakut. And welcome to join us. I'd like to begin by acknowledging that we are on the unceded traditional territories of the Algonquin people. It's also a tremendous pleasure for me today to be here with Minister Duclos, President Obed, to Dr. Hanley, and to Minister Forte. Thank you for joining us, and to my close colleague, Dr. Margot Greenwood, who's the Scientific Director of the CIHR's Institute on Indigenous Peoples' Health, along with some of the members of your staff as well, and to those who have joined us. I also want to recognize and acknowledge CIHR's Indigenous Health Research Secretariat, who are here today with us as well. You've been a tremendous support to this process, and my gratitude to you for that. They've worked behind the scenes with great care, diligence, respecting a true collaboration with ITK staff in developing the plans for the Inuit Research Network. At CIHR, we are deeply committed to working with ITK to improve health outcomes for Inuit communities through research as part of our efforts to support the self-determination of Canada's Indigenous peoples in research. Early in my term as president of CIHR, which I was just commenting, so it was 4 years ago, it's amazing how quickly things pass, I had the privilege of meeting President Obed and visiting Nunavut. This was a profound experience for me personally. It deepened my appreciation of Inuit people and culture, but more importantly of the issues with regards to health outcomes and the work that needed to be done with that. I'm very grateful to have had President Obed as my guide in this journey to understand the issues facing Inuit communities. I would also like at this moment just to say that amongst all the acknowledgements that we've done here, there's one new doctor who we've not recognized, and that would be Dr. Obed. I can tell you that your lecture schedule will be sent to you soon, and we'll be working a bit. So it's been wonderful to see this evolution and the recognition of the work that you have done to help Inuit people, and it's such a pleasure to be part of that. Since the time we first met, it's been a tremendous opportunity to build a strong relationship that's really been built on a shared belief that research initiated and led by Inuit will lead to a healthier future for all Inuit in Canada. President Obed's commitment to research led to the development of ITK's National Inuit Strategy on Research, which we've already heard about. But this strategy is a blueprint for the creation of a memorandum of understanding between our organizations in 2020 and the co-development of a 5-year work plan. The funding for the network is a milestone in that work plan and is innovative for us to be doing it. This network will enable research that empowers Inuit and meets the specific needs of Inuit families and communities. And it will ultimately strengthen long-term capacity for Inuit-led research and knowledge mobilization across all disciplines, with an emphasis on improving the health of Inuit people and well-being within and beyond Inuit Nunavut. So on behalf of Dr. Greenwood and everybody at CIHR, I want to congratulate President Obed and his team and wish them well as they focus on the implementation of the network. I'd like to say we'll be watching, but we will be thrilled to watch and to partner with you as we move forward. And we will be right there alongside you on that journey for it. So merci, thank you, and nakuramik. Thank you.
Thank you. So we will now begin the question period. Just one question, one follow-up. You can use the mic, or you can shout. The room is pretty big. Yeah.
Hi, Madeline Howitt with CNAT News. This is a question for both Mr. Duclos and President Obed. Why is ITK the government's partner on this initiative rather than the regional Inuit organizations like UIA, Natan Obed, etc.?
Great question. And thank you for the question. There are community, regional, and national components to our National Inuit Strategy on Research. Our work is guided by the Inuit Research National Committee, which is senior technical experts from each of the 4 land claim regions that advise ITK on research work, and then ultimately are the ones that are interacting with ITK about potential opportunities. So in this particular case, the research grant mechanism flows most seamlessly through ITK and then through agreements with each of the 4 land claim regions. The terms and conditions of the fund are set through the grant process, not through an ITK process. And the allocations then are based on the existing fiscal relationship that Inuit regions have through ITK and the federal government. There are some scenarios where grants flow directly from land claim regions to the federal government, but there are many instances where we are doing national work and all of the regions are a part of that work from start to finish, and the fiscal flow of funds is often an administrative part, not a defining feature of the particular opportunity.
And same question to Mr. ITK.
Well, I think we heard a great answer from President Obed. The idea is to, as he just said, want to flow those funds as seamlessly as possible, as efficiently as possible, and as inclusively as possible. And obviously, ITK has this power of doing that type of work so that the funding, and more importantly, the outcomes of that funding are as powerful as they can be for people living in Nunangat.
Any other questions or concerns? Oh, ça finit le merci. Oh,
I guess, the health research was great, but, when can we expect kind of more serious kind of health infrastructure funding, so that patients don't have to always fly away from their home communities to the south?
Well, President Obed, I can compliment. This announcement is about research, so you might feel it's disconnected from health and healthcare, but it's not the case. No, it's as we know, and a medical doctor like Dr. Strong will be even more eloquent. No, the use of the data, the awareness, all of the preventative measures that are absolutely essential in maintaining people's health and avoiding people having to access health care. All of these measures are supported by science and the work of scientists. So it's great that we now have this opportunity this afternoon to connect the scientific world with the world which we want to be improved for people living in Inuit Nunangat. And this is an example of a plan to build research and to guide the work of researchers on the basis of priorities of the people living in the land claims area in Inuit Nunangat, because that's what makes the most difference when it comes to the value of the research from a scientific perspective, but also, more importantly, the value of the research for the health and the well-being of the people living in the area. So I used to be a researcher too in my former life. I've not entirely forgotten that, and I certainly I'm quite jealous of this particular network that is going to set up, because if we had access during my years to such a network, connecting people to science and people to scientists, I think the value of our former research would have been enhanced.
And thanks for the question. There are a number of concurrent things that we were doing in relation to Inuit health. The focus on infrastructure has been one that has been ongoing for the entire term of this particular government. We saw last year in budget 2021 Inuit-specific infrastructure funding for a 3-year period. So Inuit regions had the ability to then decide how those infrastructure dollars are going to be spent. It's not something that is going to solve our infrastructure deficit, but it was a start. We are now, through the Inuit Crown Partnership Committee, doing an infrastructure deficit analysis. So we're creating an entire global understanding of the infrastructure deficit across Inuit Nunangat, whether that is water and sewer, whether it's air or marine infrastructure, or whether it's health infrastructure. We are working under good faith within that space, and we expect that as we quantify the infrastructure deficits across Inuit Nunangat, this government will meet that knowledge with action. And it is something that will take time, but we have not for a second lost sight of the massive health infrastructure deficits that demand then that most of our patients who are ill, especially for things like cancer care or complicated pregnancies, or many other medical procedures, have to come to the south instead of having those procedures done in Inuit Nunangat. It's an unacceptable reality, and one that will take time to fix, but we feel that we are making good progress within the Inuit Crown Partnership Committee and with this government.
And just one follow-up, I guess. So how would that, you spoke about income currency. How will this research kind of inform the more kind of infrastructure needs if that
I think this funding will help in a number of ways that perhaps we can't even imagine at this very moment. I can think immediately about, say, the Kanuipita Inuit Health Survey and the ongoing fieldwork that's happening. It happened first in the Nunavut region last fall. It's in the Nunatsiavut region right now, and Nunavik and Nunavut plan to do their fieldwork next year. But the outcomes of having, say, a Kanuipita Inuit Health Survey data set that then we can summarize and can then have a better understanding of health outcomes, and then the positions that we take about what are our priorities and how infrastructure fits within them. I would imagine that this research grant will allow for there to be more conversations about perhaps how that amazing opportunity that we have to understand Inuit health in a better way can be actioned across Inuit Nunangat. The same goes for different opportunities that we have with grant funding, whether it be through Polar Knowledge Canada, through ArcticNet, or through any other places where there are Inuit-specific opportunities for grant funding. Having a network and having capacity across Inuit Nunangat will allow for Inuit to make better use of existing funds, and also will allow for opportunities and partnerships that perhaps are not possible today. So it will be great to see over the next 3 years just how far the reach of this particular announcement and these funds will be. But we have optimism that we are building the implementation of our national strategy on research and creating Inuit self-determination in research to allow for a platform of success across a number of fields.
Any other questions? D'autres questions? OK, donc c'est la même affaire en présidence. That ends the press conference.
Merci beaucoup. Bravo.